You pick up your prescriptions here, and now you'll be able to get your flu shot here as well. The Premier making the long-awaited announcement that pharmacists will now be able to administer the flu shot.
We're only at about 1/3 of Ontarians getting that flu shot. And we think that if we can make it a little bit easier, a little bit more accessible for Ontarians to do that, that's a great thing.
If you haven't gotten the shot in the past, will the added convenience change your mind?
Probably, sure.
Really?
No, not really, no.
That's good to know. I won't need to go into a clinic.
I'm getting the flu shot as soon as I can get it.
This is all part of a change in the scope of practice for Ontario pharmacists, who will also be able to prescribe smoking cessation drugs and renew most prescriptions. Eager for some good news, the Liberals unveiled the changes without working out how much some of it will cost.
That's where we have to sit down with the government and talk about how do we implement that, how do we measure it, how do we pay for it, because providing new services, pharmacists expect to get paid for it.
Except Ministry of Health officials maintain the details have been worked out. Pharmacists won't be compensated for renewing prescriptions like they are in BC and Alberta.
Well, certainly compensation exists in other provinces for similar services, but the real focus needs to be on the service that's being provided and how it really eliminates or lowers long-term costs to the healthcare system.
Pharmacy companies have been at odds with the Liberals before, upset the government made changes to generic drug payments. This was supposed to help restore some balance, says the Pharmacists Association, suggesting the government may have been overwhelmed by its own good news.
Now, in terms of flu shots, there should be 600 locations in the province when the flu shot program rolls out later this month. That is supposed to quickly expand right across the province, and pharmacists will be paid $7.50 for every shot they administer. They just won't be compensated for things like prescription renewals. For more on the pharmacist compensation issue, check out the On the Ledge blog at globaltoronto.com.